The calendar says you're up to date, but your body keeps nudging you with little whispers you can't ignore. Mornings feel heavier than they used to. Your legs take a few extra steps to warm up. Sleep is choppy, energy dips arrive early, and intimacy doesn't feel as easy or inviting as it once did. You've been told your annual checkup looked fine, yet something still feels off. This is the quiet gap so many women face after 60. Standard visits that check the big boxes, while the small life-shaping details get missed. Today, I want to help you find those details, so you can walk out of your next appointment with clarity, confidence, and a plan that actually fits your life. I'm Dr. Emily Hart, and I'm here to help you navigate the changes in your body with clarity and compassion. I've spent more than 15 years caring for women in their 60s, 70s, and beyond, and I know how powerful the right questions can be. If you value gentle, science-backed support, I'd love to have you in this community. Subscribe for more videos like this and tell me in the comments where you're watching from. I love seeing the map of strong, wise women who meet here each week. Let's begin with something almost every standard checkup passes too quickly: a true medication review. Lila, 72, came to me feeling off balance by mid-afternoon. She had a dry mouth, foggy focus, and a few near falls that scared her. Her blood pressure looked good in the office, so nothing changed. But when we laid every bottle on the table, prescriptions, over-the-counter pills, and supplements, we found the pattern. 2 of her medications had what I call dim-the-lights effects on the brain and nerves. Taken together, they made her slower to think and quicker to stumble. One of her blood pressure pills peaked right around the time she gardened, which explained the lightheadedness. Here's the simple science. Some drugs block a messenger in the body called acetylcholine. Stacking those effects is like turning a dimmer switch too low. Others drop blood pressure at the wrong time of day. And supplements can interact in ways the computer doesn't always flag. With her primary doctor, we retimed one dose, removed what she no longer needed, and chose gentler options. Within weeks, Lila's head felt clear and her steps felt steady. If this sounds familiar, bring your whole list, everything, to your next appointment and say, "Can we go through these one by one? Do I still need each one? Are any of these drying, sedating, or interacting with my heart or memory?" This isn't being difficult. It's being wise. The payoff is better balance, better focus, and a day that doesn't feel like you're pushing through fog. The second place standard visits often miss is hidden nutrient gaps, especially vitamin D, vitamin B12, and iron stores. Carol, 68, told me her afternoons were sinking under a gentle, relentless fatigue. She had calf cramps at night and felt unsteady on stairs. Her routine labs were fine, but no one had checked her vitamin D or B12, and her iron stores, measured by a test called ferritin, had never been measured. We added those labs. Her vitamin D was low, her B12 was just above the threshold, and her ferritin was on the lean side even though her red blood cell count was normal. Think of vitamin D as the key that helps your body use calcium and support muscles. Think of B12 as the wiring that keeps your nerves firing on time. Ferritin is your iron pantry. If the pantry is bare, you can feel breathless and weak even before full anemia shows up. With her doctor's guidance, Carol started gentle supplements and built in small daily changes. A short noon walk when the sun was kind, a breakfast with eggs and greens, a few servings of beans each week, and regular check-ins to avoid over-supplementing. The change wasn't overnight, but it was steady. Her legs ached less, her energy held later into the day, and sleep came easier. At your next visit, ask for a 25-hydroxy-vitamin D level, a B12 level, and a ferritin level. These are simple, widely available tests that can turn the light back on in your muscles, mood, and sleep. If you have kidney disease, osteoporosis, or specific conditions, the plan will be tailored. That's why partnering with your clinician matters. You're not chasing perfect numbers. You're restoring the building blocks that carry you through your day. Next comes a pair of quiet drivers of how you feel: thyroid balance and blood sugar patterns. Denise, 64, noticed a slow slide in her energy, thinning hair, brittle nails, and sudden late-night heart flutters. Years earlier, she had a thyroid test that looked fine, so it faded into the background. When we repeated a thyroid panel with her current doctor checking TSH and free T4, her results showed the kind of borderline shift that explains real symptoms. A small medication adjustment, along with better protein at breakfast and a moonlight walk after dinner, changed her weeks. Now about blood sugar. A fasting glucose reading can look okay while the daily swings still drain you. An A1C test is like a 3-month snapshot of how your sugar has behaved. It can catch the slow climb into prediabetes that robs your sleep and sends you to the bathroom at 3 a.m. The science is simple. Your thyroid is your internal thermostat, telling cells how fast to burn fuel. When it drifts low, everything runs slower. When it drifts high, everything feels fast and jumpy. Blood sugar rides along with your meals. Big spikes make you crash, wake you at night, and keep your bladder busy. At your appointment, ask for TSH and free T4, and ask about your A1C. If your numbers suggest prediabetes, small changes go far. Front-load your day with protein and fiber, keep sweet drinks to a minimum, and take a 10-minute stroll after meals. Denise didn't overhaul her life. She tuned it. Fewer night wakings, steadier mood, and a body that felt like hers again. I also want to talk about something many women whisper about but rarely bring to their doctors: pelvic floor health and the dryness, urgency, or discomfort that often arrive years after menopause. Maria, 70, quietly stopped her long neighborhood walks because she was afraid of leaks. She also pulled away from intimacy because everything felt delicate and dry. She thought this was her new normal and felt a little embarrassed to discuss it. In her next appointment, she told the truth. We screened her for pelvic floor issues, and her doctor referred her to a pelvic floor physical therapist. These are specialists who teach your core hammock of muscles to coordinate, not clench. She also discussed local vaginal estrogen options, creams, tablets, or a ring that work right where they're applied. Picture a garden in summer. With enough moisture and care, the soil is soft and resilient. Without it, it becomes thin and fragile. With guidance from her clinician, Maria started therapy and a local treatment that was appropriate for her history. Within weeks, she noticed less urgency, less fear of coughing or laughing, and more comfort in her closest moments. If any of this resonates, bring it up, clearly and without apology. Ask, can we screen for pelvic floor issues and talk about local options to help with dryness, urgency, or intimacy? You deserve to walk, laugh, and love your life without planning every bathroom stop. And if you've had certain cancers or complex histories, your clinician will tailor the conversation to what's safest for you. If this is helpful so far, give this video a like. It lets me know these topics matter and helps more women find support they can trust. There's one more area your annual visit may skip if you don't ask: bone strength and fall risk, along with simple hearing and vision checks that support your balance. Jean, 73, broke her wrist after tripping on a throw rug. She had never had a bone density scan after 60. When we finally checked, she had osteoporosis. The science here is both sobering and hopeful. Bones are living scaffolding. They respond to the signals your muscles send. Strong legs tug on the bones and tell them to stay solid. Without that tug, and without enough vitamin D and calcium in your diet, the scaffolding thins. Add in a subtle hearing loss or an outdated pair of glasses, and your balance system, eyes, inner ears, and joints works harder to keep you steady. Jean's plan was simple and powerful. A DEXA scan to know her baseline, a conversation about treatment options, protein at each meal, supervised strength work a few days a week, a home safety sweep to tame tripping hazards, and a check of her hearing and vision. Months later, she felt more grounded walking across the kitchen and steadier on the sidewalk. For your next visit, ask when your last bone density scan was and whether it's time to repeat it. Ask your clinician to watch you stand up and walk and to check your balance for a few seconds with eyes open and closed. Ask about a short list of strength moves you can do safely at home. If hearing or vision has changed, addressing them is not vanity, it's injury prevention. The benefit is more than numbers on a report. It's the freedom to carry groceries, climb steps, and choose the scenic path. There are other quiet gaps I often see. Sleep apnea can hide behind just snoring, especially if morning headaches or daytime sleepiness tag along. Nighttime urination can be worsened by timing of fluids, certain medications, or blood sugar swings. Mood changes deserve the same attention as blood pressure. None of these make you needy, they make you human. If a symptom interrupts your life, it's worth your doctor's time. So how do you turn this into action at your next appointment? Bring a simple story of your day. I'm waking twice a night to use the bathroom. By 3 p.m. my legs feel heavy. I'm avoiding long walks because I'm worried about leaks. Clear, specific sentences help your clinician choose the right tests and the right plan. Bring your medication and supplement list exactly as you take it, including doses and times. And bring one goal. Maybe it's sleeping through the night, or walking the boardwalk without scouting for benches, or feeling comfortable and confident in intimacy again. Your goals should shape your care. The heart of this message is empowerment. Tests like vitamin D, B12, ferritin, TSH, free T4, A1C, and a bone density scan are not fancy extras. They are everyday tools that can explain how you feel and point to simple, effective steps. A true medication review is not a scolding. It's a safety check. Pelvic floor therapy is not a last resort. It's a gentle way to give strength back to the center of your body. You are not trying to be perfect. You are tuning your body so it moves through the day with less friction and more grace. You deserve care that sees the whole of you. If your last checkup left you with more questions than answers, this is your invitation to go back with a clear voice and a short list of asks. You can say, I'd like to review my medications, check vitamin D, B12 and ferritin, look at my thyroid and A1C, discuss pelvic floor health, and see if I'm due for a bone density scan. That single sentence opens doors. It tells your clinician what matters most. Your energy, your balance, your comfort, your independence. Before we close, let me remind you of what I tell my patients every day. You are not too old. You are not broken. And you are absolutely not alone. Your body still responds to care, to attention, and to the right kind of effort. If today's video gave you language or courage you needed, I'd love for you to subscribe and stay part of this growing circle of strong, informed women. Share this with a sister, a neighbor, or a friend who keeps saying, I'm fine, while her eyes tell a different story. And I'd love to hear from you in the comments. Which of these steps are you bringing to your next visit? Take care of yourself. You're worth it. I'm Dr. Emily Hart, and I'll see you in the next one.